and welcome back to the Nurse on the Go podcast. In today's episode, I'll be discussing with all of you the top paying nursing professions. I'll be beginning with number 10, being one of the least out of the top 10 paying nursing professions, and then I'll be going all the way to number 1, which is the top paying nursing profession. Stay tuned to find out the top 10 highest paid nursing professions. At number 10 is a pediatric nurse. A pediatric nurse makes about $60,000 every year, and that's just the median salary annually. A pediatric nurse is someone who enjoys working with children, and their work involves providing screenings, immunizations, and providing treatment to very young patients. So along with that, pediatric nurses also consult with the parents and guardians of those patients to just keep them up to date after doing an annual checkup, or if anything has come up with the children's health and wellness. So pediatric nurse typically must secure a master's degree in nursing and also hold on to a registered nurse license before applying for a nursing practice license. Number 9 is a neonatal nurse. So a neonatal nurse makes a median annual salary of $64,000. The responsibilities and work of a neonatal nurse is to focus on newborns and typically work in NICU units. They mainly assist with the illnesses and serious medical issues that come up with newborn babies, and this job requires that the nurse have quick thinking and really know how to provide life-saving care as problems may arise quickly and suddenly, and they must hold on to a Bachelor of Science in Nursing and a registered nurse license in order to be eligible. At number 8 is a nurse researcher. A nurse researcher has a median annual salary of $81,000. These professionals design research studies. They also work to collect, analyze, and prepare data. And once they've collected all their data, they create reports to release all of the results. So typically, nurse researchers work in labs, they work in universities, they collect data so that they can improve the care of nurses and the profession of nursing as a whole. To be a nurse researcher, they typically carry a master's or doctorate degree. Nurse researchers also help medical professionals advance in all the levels of care directed to patient care. At number 7 is a clinical nurse specialist. A clinical nurse specialist makes about a median annual salary of $90,000. A CNS typically assesses, makes diagnoses, and also treats illnesses while working to improve the health systems and processes. So they tend to work in really detailed specialties such as labor and delivery or family nursing or pediatrics, mental health, just really specialized care of nursing. And to be a clinical nurse specialist, you have to have a state license. A CNS must also carry a master's degree in nursing and pass a national certification exam. At number 6, we have a geriatric nurse. At number 6 is a geriatric nurse. A geriatric's median annual salary is $97,000. Typically, a geriatric nurse is someone who provides care to the elderly population. They help the patients manage their health conditions and also assist them in living a healthy lifestyle in also accordance to independence. These nurses typically administer medications, injections. They continuously monitor vitals and discuss treatment options with the patient and their families. While most geriatric nurses have a master's degree, some practices and institutions will accept a nurse with a Bachelor of Science in Nursing and an RN license. At number 5, we have an orthopedic nurse. An orthopedic nurse makes a median annual salary of $100,000. These nurses assist patients with conditions of their musculoskeletal system, like if they have any broken bones or if the patients have arthritis, osteoporosis, etc. They provide treatment and they assist with dosage calculations and medications, and they also have to continuously monitor vital signs and many other things. Each orthopedic nurse must have a Bachelor of Science in Nursing and registered nurse license. They must also pass an orthopedic nurse certification exam. At number 4, we have a certified nurse midwife. So a nurse midwife makes a mean annual salary of $102,000. So nurse midwives really focus on women's health care through preventative care. They provide guidance through their pregnancies, menopause, postpartum care. So they really assist women throughout their whole entire lifespan in different conditions that may arise. Certified nurse midwives also monitor and treat newborn babies right after they're born and shortly after their birth. Each nurse midwife must have a master's degree. They must have a license taken by the American Midwifery Certification Board exam. And I'm assuming as well with different countries, you must also do a certification board exam to be certified as a nurse midwife. At number 3 is a psychiatric nurse practitioner. A psychiatric nurse practitioner makes a median annual salary of $106,000. These psychiatric nurse practitioners really focus on the patients exhibiting signs of mental illness, so their whole field is focused on mental illness and neurological disorders, such as dementia and many other disorders. They provide care and they administer medications along with engaging with different types of people and individuals and helping them cope with their mental illnesses and providing them with ways of dealing with it. In a sense, a psychiatric nurse practitioner is also there to provide counseling to these patients and to let them know that they're not alone, and they give them someone to talk to and provide a form of therapy. Someone who wants to be a psychiatric nurse practitioner must have a master's degree in nursing and also pass the national licensing examination. At number 2, we have a nurse practitioner. A nurse practitioner makes a mean annual salary of $110,000. So we're talking about a lot of money here. A nurse practitioner is someone known as advanced practice nurses. These professionals are often seen independently, capable of diagnosing illnesses. They're also able to provide treatment plans and prescribe medications to their patients. They also, in some areas and institutions, have the responsibilities of serving as the primary care providers. A nurse practitioner must have a master's or doctorate degree and may specialize in specialized areas such as acute care, such as labor and delivery. They may also work in every other specialized institution and specialty. And the number 1 top paying nursing profession is a certified registered nurse anesthesiast. Their median annual salary is $151,000. That is a whole lot of money, and that is a great paying profession. Nurse anesthetists handle the administration of anesthesia, and they assist in managing pain in all different healthcare organizations, and they make sure that patients contain and maintain a healthy vital signs while administering the anesthesia. Each CRNA must receive a Bachelor of Science in Nursing. They must also have an RN license and have gained nursing experience. A CRNA must then secure a master's degree in nursing anesthesia. They must be organized. They must be detail-oriented, as this duty of being an anesthesiologist is very crucial and very descriptive and detailed. And they must be people who know how to be lifesavers and think quickly and can assist to any problems, such as if they're administering an anesthesia and let's say the vital signs of a patient spikes, they must know how to bring those levels down depending on who the patient is and in a time-effective manner so that the patient does not pass away. So if you're someone in nursing school right now and thinking about what you want to be in the future, for some, it really depends on where their heart lies and what they really see themselves doing. But for some, it really has to do with the benefits financially. And this is a really top paying nursing profession. So if you're considering that, I really recommend you do your research on being an anesthesiast. It's a great profession. And of course, being a nurse in any profession is rewarding. And I guarantee that this one will be rewarding as well. Those are all the top 10 highest paid nursing professions. I hope you guys learned something or took something away. If you were someone who was undecided on what profession you wanted to do, and maybe one of these piqued your interest, or if you're a nursing student like I am and one of these seemed very interesting to you and something that you really want to look forward to or do your research on, I highly recommend that you do that. All these professions are really amazing, and of course there's many other professions out there that you could possibly be interested in. So know that there's endless possibilities for us nurses and nursing students to become once we are nurses. I want to thank you guys so much for tuning in to today's podcast. I want to remind you all that I do have an Instagram at the Nurse on the Go podcast, where I post every single day new uploads such as motivation, such as educational posts, and they're just really great to stay tuned with. They keep you really motivated and on track. So thank you so much for tuning in, you guys, once again, and I hope to see you next week on my next podcast, which will be uploaded on Monday. Talk to you soon. The Nurse on the Go.